On Friday, April 24th, Governor Hogan released Maryland Strong, Roadmap to Recovery. This roadmap provides guidance on how to gradually and safely reopen Maryland. Although this plan provides direction, we do not yet have a date for when the state will reopen, as the virus will ultimately dictate the speed at which the state can move. The 4 building blocks of the governor's recovery plan include an expanded testing capacity, an increased hospital surge capacity, ramping up supply of personal protective equipment, and a robust contact tracing operation. All 4 of these building blocks are currently on track or ahead of schedule. From there, the roadmap defines 3 distinct stages: low risk, medium risk, and high risk. These stages are broad in character and have gating benchmarks within each that will trigger when it is safe to move to the next stage or backtrack if there are things that have worsened. For more detailed information on Maryland Strong Roadmap to Recovery, please visit Governor Hogan's website at governor.maryland.gov/. As refreshing as it is to hear that we are moving forward to reopening Maryland, I have to emphasize the importance of not disregarding the mitigation efforts currently in place. In the Maryland Strong Roadmap to Recovery plan, it lists several stop signs that would require the easing of restrictions to slow, stop, or even be reversed. One of these stop signs are indications that Marylanders are disregarding physical distancing guidelines. If people can maintain social distancing for this period while we ramp up testing and contact tracing, we will have a much higher chance to reopen without seeing a spike in cases. As mentioned above, in the governor's 4 building blocks, increasing testing capacity is essential to the process of easing restrictions. With the governor's leadership, the state of Maryland successfully acquired 500,000 COVID-19 tests from the Republic of Korea. While this is a tremendous acquisition, I want to prepare the public that with increased testing, everyone should expect to see an increase in confirmed cases. This expected spike in positive cases will not necessarily reflect an actual spike in COVID-19 conditions in our county, but may show that our vigorous testing program is now capturing a more accurate snapshot of the county as a whole. As always, thank you to healthcare providers and first responders who are on the front lines every day, and thank you to everyone for continuing to follow the state's guidelines to help flatten the curve. We will get through this together.